And as you know, the 1st of December was World AIDS Day. So just in light of what we've been through as a country, the pandemic, we reflect on both the remarkable progress that has been made against HIV as well as the considerable challenges that remain. We have had highly effective HIV treatment and prevention methods, and work has been underway to address the remaining challenges in delivering these tools to people who need them most, as well as to develop new interventions. The National Institutes of Health continue to advance rigorous, innovative research to prevent new HIV transmissions and improve the health of people with HIV worldwide. To talk more about what has happened in the line of treatment and how the lives of those who are living with HIV/AIDS have been impacted. We're joined now by sexual reproductive health specialist Dr. Tlaleng Mofokeng, who's also an author and commissioner for gender equality, as well as Nomfundo Eland from Emthonjeni Counseling and Training. Thank you so much for joining us. And we really appreciate the time for you to talk to us and reflect on this. Dr. T, let me start with you. I mean, we were talking a whole different story last week, and I just want to make sure I get the wording right, because I had to really study how to say that. Reproductive. So we were talking about that last year, how it was very promising, but it seems that this year, a year later, we're saying for sub-Saharan Africa, or Southern Africa rather, this may not necessarily be the answer. Tell us, what are the changes that have occurred since last year?
Thank you very much, Tsepiso, for inviting me. And I think it's important to understand that all of the innovations that are currently happening and the progress around HIV prevention is really, really important work. I think it's important to understand that the right to sexual health and well-being is part of a human rights framework, and it is incumbent upon states, upon health systems to ensure that particularly young women who remain vulnerable to HIV acquisition have tools accessible to them that they can use, that they can negotiate, and that they can then actually ensure that is used properly every single time, and that they actually work well. And so we do welcome research, and it's actually a good thing if during a research process people stop to take stock of what's happening, to monitor and evaluate, and if need be, change direction or course in terms of what's available. But it is welcome in terms of the bigger strategy around the world, not only to give young women information, but to also make sure that they have access to essential services and medications for their own sexual and reproductive health.
And let me come to you, Ms. Eland. There was a lot of talk about the vaginal ring. Just bring us up to speed on what progress has been made and what is there to celebrate in the fight against HIV/AIDS.
Thank you so much. The vaginal ring has been one of the key milestones in the HIV prevention research. We know that we had a lot of not so good news when it comes to microbicides research. And this has been one of the key research that women took into their own hands to say, no, we need a product that is driven by women, that is going to be, women are going to use this independent of whether their partners know or not. Because at the end of the day, prevention is really about an individual. And protecting women. We know that we had a lot of losses when it comes to issues of condom negotiation because of the kind of environment that the relationship, women in relationship has, the intimate partner violence that most dominate in women. And gender-based violence is the key driver of HIV. So this ring gives hope to women. It has not been licensed as yet. We just had a huge milestone that it has been approved by IMA to say it actually does work. And this is a huge milestone because we have had bad news when it comes to prevention that is geared towards women. And yet women are the most bearing, branch of the HIV epidemic. So for now, we are saying that women need to know about this ring. We are really advocating and we're giving women information about this ring. It is entirely upon our government to actually say, how are we preparing for the ring to be licensed in our own environment so that women can get hold of it, because women cannot wait for this ring. So the innovative of having the microbicide ring in the hands of women would actually add up to leveling lesser infections of HIV.
A very interesting point. Dr. T, I'd like to bring you in on this, because that intersection of, as Ms. Eland here is talking about empowering women. I know you have written on the subject. Your book is all about being empowered, being open about it. And HIV/AIDS is something that is generally seen as disempowering. So talk to me about how all of these intersect, because it's very interesting to say, you know, you don't have to necessarily declare, it should be your decision.
Absolutely. And we have to be honest, you know, talking about sex and sexuality can be difficult for both, you know, the clients themselves as well as health services providers. And I think it's important to keep the discussions ongoing, but to locate them within a human rights perspective and a framework, because we know that to have sexual health and well-being, you need your human rights protected, which is now the intersection of gender-based violence and HIV risk acquisition. And the South African Medical Research Council did an amazing research that was launched just this week, talking about the risks of HIV acquisition associated with rape and gender-based violence. But at the same time, the tools that we are discussing tonight, the ring, you know, the internal condom, the PrEP, post-exposure prophylaxis, all of those health tools reduce inequalities, because we know that HIV acquisition and gender-based violence still is a predominantly a women's that are experiencing it. We also have to integrate the HIV response into the broader sexual and reproductive health care. We can't, I think, in my view, get where we need to if we are still only talking about HIV and then talking about stigma and fear and disease. I think establishing a sexual pleasure as a starting point, you are able to provide a broader and more positive focus on sexuality and sexual health, thereby helping young people make informed decisions, as opposed to not giving them information and then asking them, you know, to take all these pledges that they will remain virgins. But I think it's important to understand and assist young people navigate sexual relationships, avoid risks, but also be able to take independent decisions around prevention methods. And I think a lot of these tools that you are talking about are really important, especially for young women, as well as, of course, incorporating them into digital innovation and interventions, because we know with COVID, a lot of young women were not sure which services are available and which aren't. And I think by using technology and integrating in digital interventions, we are able to give more information, and young people can go to the clinics themselves and demand these wonderful products.
We'll talk at the scientific changes in just a moment, what has happened. But Ms. Eland, I want to talk then about behavioral changes. Are you somebody like Yvette Raphael, as an example? She was talking about how she's celebrating that 20-year milestone of being HIV positive. And she was very emotional about looking at where she is now, not only in the fight of HIV/AIDS, but I want to understand what attitudinal changes have there been, if any, especially now that people have had to deal with a pandemic like COVID-19, something that doesn't discriminate, that crosses color barriers, that crosses class, that, you know, age, all kinds of demographics. Has that made people realize that some things are not necessarily a person's fault, as in it's not because of sexual promiscuity or, you know, lack of consciousness in taking care of themselves?
Most definitely, there has been change in attitudes of people, although we still find that stigma hasn't changed that much. And with conversations that we are openly doing in communities like the Stigma Index, Yvette Raphael's organization is actually championing this in communities. We're finding that people are starting to speak openly about HIV and about treatment. That is why you see that we are doing a lot much more greater when you look at the 1990 strategy, and you see that lots more other people are testing, but we're still doing not so much better on issues of having to, initiate people on treatment because of the stigma-related issues, which is something that we really need to deal with. But when you look at people who are staying with treatment because they take health issues, because we are starting to move into a language that Dr. T is talking about, not only just isolating the issue of HIV, but when you speak about HIV, you also incorporate issues of sexual and reproductive health. You also incorporate issues of mental health. You deal with those issues so that it is a comprehensive conversation than an isolated conversation. Now we are seeing that shift in the kind of discussions and the behavioral change from people. Thank you.
Dr. T, I'd like to bring a conversation that the world is having now, that is of vaccination, obviously here against COVID-19. But there has been a long journey in terms of vaccination of HIV/AIDS, and there have been many changes, medical changes. NNRTI, I think, at some point, those were very much pivotal to the treatment that people are taking for HIV/AIDS. But because of the mutations of the virus, I believe then that has changed the picture. So what do we keep in mind? How possible is it to take science and medical treatment and behavioral change to fight this?
Yeah, look, I think it's important. HIV programs across the world have really, highlighted it to us, the political will those patients and clients who require HIV testing and treatment. And I think the amazing progress that has been done in terms of research, in terms of data collection, in terms of bringing the communities and the grassroots closer to where the programs are, has been really something important to learn. And I understand, of course, with research and development and innovation, all of us are sort of, desperate for this HIV vaccine and for sort of that next step. But I want to reiterate that there is still
okay, she's frozen.
Time people have sex is important.
Dr. T, if I could just ask you to repeat that, because I suspect you're going to make an important point. You want to reiterate? That,
in fact, the tools that we currently have in terms of safe and proper use and consistent use of condoms is important. We have pre-exposure prophylaxis medication, which works both for vaginal and anal sex and works really well when taken properly. And we do have access to post-exposure prophylaxis for those incidences where there are accidents, or for some people who do have, who are victims or survive rape or gender-based violence. And I know that as much as we want this vaccine to really come today for HIV, there is still so much that we do have access for, that we know works, that still isn't reaching the communities. And I think this is the phase when you are trying to reach the 2030 SDG goals. The Commission for Gender Equality is doing amazing work in terms of looking at health equity and how we can get communities to have access to these life-saving medication. But more importantly, through our education and legal clinics and outreach, we are able to give communities and patients information to advocate for their own rights and demand for their protection of their own rights, and how we practice medicine in the public health sector can promote and protect these rights.
And Ms. Eland, perhaps as a final thought, then again, to borrow from our current circumstances, we know that access to HIV services and medications have been disrupted. What are the communities saying about the impact of that? Has it really set us back? And what can we do also in improving community communication platforms?
The issues of non-availability of HIV medication when it's needed is becoming a huge problem. A lot of other provinces have been stating that they are stock out. And the government has been saying is the issue of management at a facility level and at a district level, which is making this work, which makes us to take 2 steps ahead and then 5 steps behind, because now we are pushing on demand creation, making people aware why it is important for them to take their treatment, ask people to test and know their statuses, but when they want to go and get medication and medication is not available. So this is really becoming problematic, especially for people who have, been supported to stay and take their treatment well. Now that is going to be disrupted as well. This has become really a problem, and we are saying if we cannot put our ducks together with the available tools to prevent HIV and to treat HIV, how much more with those that are coming with research? It means that they will come into a messed up system and the people that are supposed to get them, they would not be able to get them and access them. We're talking about injectable PrEPs, we're talking about the vaginal ring that is in the pipeline. But if we don't get what we have right, it means those would also not get into the hands of people that need them.
And just a final word, Dr. T, what conversations are then being had at the UN? I know you were very recently part of such a conversation in relation with SDGs, because those are very important. We can talk about various HIV prevention modalities and new inventions, but everything has to be sewn together, including nutrition, including ensuring that developing countries are not just dependent on aid from developed countries.
Absolutely, that's an important one, because we know that in terms of health financing and planning, the world really is lagging behind, and HIV/AIDS still remains one of the major global public health, issues and of concern. And we know when the targets are for 2030 of 90, even South Africa is lagging behind in terms of that target. And we know that inequity shapes the HIV structural challenges that are born instead by individuals, and it's through this differential access to healthcare, the underlying determinants of health, socioeconomic status, and other structural factors, they interact to generate and reinforce these negative outcomes that, again, still disproportionately affect, Black people, Indigenous people, and as well as young women. And so we do need to pay special attention to the needs of people in vulnerable situations, often who are neglected and already in the margins, like sex workers, people with disabilities, older persons, people who are internally displaced or experiencing homelessness, and people in detention, migrants, refugees, and people using drugs, as well as the LGBT and gender diverse persons, because we cannot all of us win if we still criminalize individuals who are already finding themselves in vulnerable situations. And the United Nations, as well as its pragmatic bodies such as the UNFPA, UNAIDS, UNESCO, all of them are geared towards ending criminalization of human rights. And the right to health remains an important part to make sure that everyone enjoys the right to health and the highest attainable standard of physical and mental health.
Thank you very much to you both, and hopefully we'll have a much wider discussion on universal health coverage, or what some of the blockages are, what are the challenges. Thank you. Sexual reproductive health specialist and author Dr. Tlaleng Mofokeng, who is also with the Commission for Gender Equality, Nomfundo Eland from Emthonjeni Counseling and Training, and HIV/AIDS activist. Thank you very much to you both. We're going to take a quick